Hello, everyone. My name is Erica Covington, and today I'll be presenting my research synthesis on technology assisted counseling interventions. My goal is to explore how tools like virtual reality, mobile CBT apps, internet delivered CBT, and transcranial magnetic stimulation are being used to support mental health treatment and what this means for our work as counselors. The research I reviewed includes several clinic trials and meta-analysis, along with guidance from my counseling research textbook by Ship Harris and her co-authors. Together, these sources help me form a clearer understanding of how technology is changing the landscape of mental health care. To start, I want to explain why technology-assisted interventions matter. We know there is a major shortage of mental health providers, especially in rural areas, and many clients face barriers like transportation, long wait lists, physical limitations, or scheduling issues. Technology creates new possibilities for care by reducing some of these barriers. Our textbook authors emphasize that counselors should evaluate emerging tools using a scientific mindset. This means looking closely at research, outcomes, and client fit before adopting new approaches. With that in mind, I examined studies on several different technologies to understand how effective they are, how they compare to more traditional counseling methods, and what practical realities counselors should consider. The questions guiding this presentation include: do technology assisted interventions actually work? How do they compare to in person therapy? What features like guidance, structure, or delivery method matter most for outcomes? And what ethical and cultural considerations should we keep in mind? These questions help shape the direction of the synthesis and the themes that emerged across the research. I'll begin with virtual reality exposure therapy. A research team led by Bouchard conducted a rigorous randomized controlled trial comparing virtual reality exposure with traditional in person exposure for social anxiety. Their findings were impressive, where the virtual reality approach worked just as well as a real world exposure, and many clients preferred it because it felt safer and more private. For example, people with social anxiety often fear embarrassment during exposure, so VR gives them a way to practice challenging situations like public speaking or meeting new people in a controlled environment without feeling judged. So this makes VR a powerful option for counselors when real life exposure is too overwhelming or logistically difficult. Cognitive behavioral therapy has been tested across different methods and populations. Another study led by Bress and a team of clinical researchers evaluated a fully self guided mobile CBT program for young adults with anxiety. What stood out was the participants significantly reduced their anxiety symptoms, even though there was no therapist involved. So, this shows that some clients, especially young adults who value flexibility and privacy, may benefit from structured, well designed apps based on CBD principles. This doesn't mean an app can replace counseling, but it does mean counselors can recommend or integrate mobile tools to help clients practice skills between sessions or as an entry point for those not ready for in person therapy. I also reviewed a large meta analysis conducted by a group of researchers examining internet delivered CBT across a wide range of diagnoses. What they found is that online CBD programs are highly effective for depression, anxiety, and related disorders. Programs that include some type of guidance, even brief check ins, consistently had stronger outcomes than programs clients completed entirely on their own. This suggests that combining structural digital tools with counselor support can be a very effective and efficient way to deliver treatment. It also opens doors for clients in rural areas or those who can't attend weekly sessions in person. Age plays a vital role in how we conduct internet based CBT interventions. Another research team led by Wu focused on specifically adolescents. Their meta analysis showed that internet delivered CBT significantly reduced depression and anxiety symptoms for teens. This is important because adolescents often face additional obstacles in receiving treatment, such as transportation needs, school schedules, or discomfort with traditional therapy session settings. Digital programs help overcome many of these barriers. The research also shows that programs with structured models and modules and occasional support tended to work best for this age group. I also examined a web based CBT program designed for older adults. This project, led by Yang and a team of mental health researchers, incorporated encouragement weekly and brief check ins from trained lay people rather than licensed therapists. This model significantly reduced depressive symptoms for older participants, showing that older adults can engage effectively with digital interventions when they receive the right level of support. This is especially meaningful for individuals who face mobility challenges or live in areas with limited access to mental health professionals. Another technology I'd reviewed was transcranial magnetic stimulation, or TMS, used especially for clients with treatment resistant symptoms. A group of clinical researchers led by Philip evaluated a compressed 5-day TMS protocol for individuals with PTSD. The results showed strong symptom reductions in a very short period of time. Although TMS is a medical procedure rather than counseling, it has important implications for our field. Counselors frequently work with clients who have chronic trauma symptoms, and understanding how TMS fits into their treatment plan can help us collaborate with medical providers and support clients before, during, and after treatment. It's also typically referred by a mental health clinician. When looking across all of these findings, there are clear themes emerging. First, technology assisted interventions consistently produce meaningful improvements in mental health symptoms across different ranges of populations: young adults, adolescents, older adults, individuals with chronic or severe conditions. Second, the level of guidance matters. Across the digital CBT studies, programs that included some type of human support, whether the therapist, a coach, or even a trained volunteer, tend to show the strongest outcomes. Third, technology improves accessibility. Many clients who would not otherwise participate in therapy can now receive care through digital platforms, mobile apps, or VR tools. And finally, different technologies serve different purposes. VR is especially helpful for exposure work. Mobile apps support skill practice. Internet-based CBT provides structured treatment flexibility, and TMS offers an option for those who haven't responded to traditional therapy. These findings have important implications for counselors. First, we need to assess each client's comfort with technology. Not everyone has the same level of digital literacy, and counselors have to determine whether a given tool is actually a good fit. Second, it's important to match the technology to the client's needs. For example, a self paced app might work for some mild anxiety, but someone with more severe symptoms may need a guided program or an ongoing in person session. Third, tools like VR can make exposure therapy more approachable, while mobile apps can support practice between sessions. For medical interventions like TMS, counselors can provide emotional support, help clients process their experience, and work collaboratively with the medical team. So, no matter which tools we use, outcome monitoring is essential so that we could track progress and adjust treatment plan as needed. There are also important ethical and cultural factors to consider. Privacy and data security are among the biggest concerns with digital mental health tools. Clients need clear information about how their data is handled and what risks might exist. Another issue is the digital divide. Clients living in rural areas, low income households, or older clients may not have reliable internet access or the skills needed to navigate digital programs. So we must be careful not to unintentionally exclude those clients. Cultural relevance is also essential. Many digital platforms are built around general or Western based examples, so they may not resonate with clients from different backgrounds. Our responsibility as counselors is to choose tools that fit the client's culture, abilities, and access level, and to avoid assuming that a technology would work the same for everyone. In closing, the overall conclusion from this research is that technology assisted interventions can significantly expand how we deliver mental health care. VR, mobile CBT apps, online CBT programs, TMS, and other treatments not shown in this presentation. Um, the ones I've researched, though, however, show strong evidence for reducing symptoms and increasing access. At the same time, these interventions work best with counselor involvement. Technology enhances rather than replaces the therapeutic relationship. Looking ahead, the research community needs to include more diverse participants in these studies so we can understand how these tools work across cultures and backgrounds. We also need studies that look at long term outcomes to see how lasting these improvements are. Another major need is the development of culturally tailored digital interventions that match the lived experiences of the communities using them. And finally, there is a growing need for better integration across health systems so that digital tools, counselors, and medical providers can work more seamlessly together. Technology is becoming a central part of mental health. And when used responsibly and ethically, it can help us reach clients in ways that weren't possible before. Thank you so much for your time and your attention.